And welcome to day 2 of our Medicare Basics or Medicare 101 training. Sorry that you have to listen to my voice yet again. In fact, you'll be listening to my voice for the entire day since we'll also be doing the Medicaid transitions training at 2 p.m. But as Dan and Catherine pointed out, this is the last day of the intensive. So thank you all for going through all these trainings this week. Let me just. So today's learning objectives, after this presentation, you should be able to determine whether Medicare pays primary or secondary to other insurance a beneficiary may have, like job-based insurance or COBRA, and also identify Medicare cost assistance programs a beneficiary may qualify for that can help with Medicare out-of-pocket costs. So in terms of Medicare coordination of benefits, this refers to the sharing of costs by two or more health plans. How other health plans coordinate with Medicare really depends on several things, whether the person's Medicare eligibility is based on age or if they're under the age of 65 on disability or end-stage renal disease. However, this presentation doesn't include coordination of benefits rules for ESRD. We could spend a whole day on ESRD coordination of benefits, but I just want to bring to your attention that ESRD, Medicare, and other health insurance does have their own little world in terms of coordination of benefits. So if you do come across that, always feel free to bring it to the Medicare Rights attention. It also depends on the kind of plan a person may have, such as group health plan, based on current employment, or retiree health insurance. This determines whether it's going to act as primary or secondary insurance. The size of the employer also determines whether it's primary or secondary. So when a beneficiary has Medicare and another type of insurance, Medicare pays either primary or secondary for medical claims. Primary insurance, of course, pays first on claims, and then secondary insurance can pay after primary insurance, usually pays all or some of the costs left after primary insurer pays, such as copays or deductibles, coinsurance. If the primary insurer denies a claim, the secondary insurer may or may not make independent determination on it, depending on the plan. So it's dependent upon the policy, benefits, and structure of that secondary insurance. So if it's denied by the primary, it can be picked up by the secondary, but also it may not be able to, depending on the plan. So first we'll look at the coordination of benefits between Medicare and job-based insurance. So this is job-based insurance based on current employment. Medicare is primary if the individual is eligible for Medicare due to age, meaning they're 65 years or older. Medicare pays primary when there are fewer than 20 employees at a company where the beneficiary or their spouse works. If the individual is eligible for Medicare due to disability, meaning they're under the age of 65, the Medicare pays primary when there are fewer than 100 employees at the company where the beneficiary, the spouse, or a family member works. In these cases, the employer group health plan, or the GHP as is often referred to, is secondary. So let's take a closer look at Medicare as primary for those who have aged into Medicare. Again, folks who are eligible for Medicare once they reach the age of 65. Medicare is primary for those covered by a GHP based on current work, and that's the key word there, current work, with an employer or company that has fewer than 20 employees. The GHP can be the individual's or a spouse's GHP based on their current employment. Maybe a person may be able to keep a GHP as secondary when Medicare is primary. However, because Medicare is primary, the individual may have no health coverage if they decline Part B. So when Medicare is primary in such a scenario for somebody who's aged into Medicare, it is always advisable for that person to take Part B because Part B would be primary for them. federal law does not require the employer group health plan, the GHP, to pay before Medicare. It could act as secondary for sure, but it's not required to pay primary. And that's why it's very advisable for somebody who finds themselves in that situation to take Part B. If a GHP does pay as primary in such a situation, it may be doing so because it does not know the individual is eligible for Medicare. So sometimes if somebody does become eligible for Medicare, they turn 65 and they're working and their employer has less than 20 employees, you know, if they don't know themselves that they should enroll into Medicare Part B, because Part B should be primary over their employer group health plan, sometimes they could go months or even years without knowing that they should have done that. And also, the employer group health plan can also sometimes go months or years without knowing that they should have been secondary to Part B. So they could be paying primary for all this time when really they should have been paying secondary. However, eventually, and from our experiences, they do eventually catch up. They do eventually know that they should have been paying secondary, and at that point, they could definitely stop paying secondary because they could stop paying primary because they shouldn't have been paying primary, and then they could recoup any of the claims that they paid as primary from the employee, from the beneficiary. So a very, very just disastrous situation to be in for folks who make that decision to decline Part B when they shouldn't have declined Part B because their employer had less than 20 employees. Now, a person who does find themselves in this situation, they actually can still use the Part B SEP. So the Part B SEP is intact, even if the group health plan is secondary to Medicare because they have less than 20 employees. If they go, a few years with that employer group health plan, even though it has less than 20 employees, they're still currently working. That means that they have access to the Part B SEP. So they could use the Part B SEP at that time once they find out of their mistake to enroll into Part B. However, they would probably still have to deal with the recoupment aspect of the situation where the group health plan is now recouping past claims that they paid as primary when really they should have been paying as secondary to Medicare. However, they do still have that access to the Part B SEP. But that's why it's always very, very advisable for folks to really understand the Medicare coordination of benefits rules and to really, really be aware of the size of their employer and how that determines whether or not Medicare is primary or secondary to their employer group health plan. Medicare is primary for folks who are under the age of 65 and eligible due to disability if they are covered by a group health plan that is based on current employment, current work, and that company or employer has fewer than 100 employees. So the group health plan can be either the individuals or their spouses or other family members. Yeah, but if it's less than 100 employees, Medicare is primary to their employer group health plan. Of course, they may be able to keep that employer group health plan as secondary. However, after getting SSDI for 24 consecutive months, the individual will be automatically enrolled into both Part A and Part B. Some folks, when they see that and they're still working and they have employer-based coverage, they may be hesitant to keep Part B because Part B is going to take away the premiums every month from their Social Security disability insurance. However, if they do so and their employer is less than 100 employees, then they're essentially dropping their primary outpatient coverage. Because again, if they are working or their spouse is working and that employer has less than 100 employees, Medicare is primary to that employer group health plan. So a person who finds themselves in this situation should definitely keep Part B, should not decline Part B because Medicare is primary to group health plan. And again, they could be in the same scenario that I had mentioned before, where they could go maybe a few months or even a few years if they decided to decline Part B and their group health plan has been paying primary for that time, but it'll eventually catch up and they will eventually find out that they should have been paying secondary if Medicare should have been primary for that individual. The Part B may also still apply for these folks. However, they're only eligible for the Part B SEP if health coverage is from their own or their spouse's employer, not from another family members. So, job-based insurance plans that are secondary to Medicare, they don't, again, according to federal regulations, they do not have to provide the same health insurance for people eligible for Medicare if they're secondary to Medicare. However, the plan, if they so choose to, they can choose to keep paying primary after the individual does become Medicare eligible. That is on a voluntary basis, and the ultimate decision is up to the employer. However, if the plan does agree to pay primary, the individual may not need to enroll into Part B because they have decided to pay primary for that person. This is rare. If it does happen, we always do advise that the person get that in writing and to laminate that, because it's a very rare scenario to occur. But if they do voluntarily decide to keep paying as primary for that employee, then it's always advisable to get that in writing, because down the line, if there's any issues, then they could have something in writing as evidence that will confirm that their plan or their employer did decide to voluntarily pay as primary payer for their health insurance, even though they aren't required to do so by law. So now we'll talk about when Medicare is secondary. So Medicare is secondary for folks who have aged into Medicare, 65 and over, if they have group health plan coverage based on the current employment and that employer or that company has 20 or more employees. In that situation, that person can most definitely delay enrollment into Part B if they so choose to. And then they could use a Part B SEP for up to 8 months after they no longer have job-based group health plan coverage to enroll into Part B. But if they want to decline Part B when they become Medicare eligible and they're still working and their employer has 20 or more employees, then they could do so without any consequence, without any fear of getting recouped for claims that were paid by their employer group health plan, without fear of being stuck out of the Part B SEP, as long as they use the Part B SEP within the 8-month time period of losing their group health plan coverage. So that's a situation where they could definitely decline Part B without consequence. Medicare is secondary for employees who are under the age of 65, currently working, or their spouse is currently working, or other members currently working, and that employer or that company has more than 100 employees. They can delay enrollment and use the Part B SEP for up to 8 months after they no longer have job-based large group health plan coverage. And large group health plan coverage just means that it's a large group health plan, meaning it has more than 100 employees, as opposed to a regular group health plan coverage, at least in terms of how Medicare defines these terms. So in this situation, this employee would have Medicare as secondary and the large group health plan coverage as primary. So they can decline Part B if they want to. So in a situation where they have primary health insurance through their employer, the individual can take Part B even if they don't, even if they have primary coverage based on current employment. It's up to the individual if they want to take Part B, so be it. If they want to decline Part B, again, completely their decision, and they could decline Part B without consequence if they meet that scenario whereby the employer size is the specific amount where they would be primary to Medicare. If they take Part B, it may pay as secondary insurer. It may cover cost sharing. It may cover things like deductibles, co-pays, and co-insurances after the primary insurer pays. If the individual drops employer insurance, then Part B becomes primary if they are already enrolled in it. So it does make things a little bit more streamlined. If they already have Part B and they lose employer coverage, they don't have to worry about the Part B SEP or using the Part B SEP within 8 months because they already have Part B, and their Part B will just become primary as soon as they lose that employer health coverage. So here's just a visual representation of what we just talked about. Coordination of benefits and group health plans. So the condition being 65 years or older, currently working, company has fewer than 20 employees. In that situation, Medicare is primary to the group health plan. If somebody is disabled, under the age of 65, currently working, and a company or employer with fewer than 100 employees, in that situation, Medicare is primary to their employer group health plan. And the asterisk there, just a reminder that in those situations, even though Medicare is primary to their employer health plan, the group health plan may choose to be primary regardless of the individual's eligibility for Medicare. However, again, it's rare, and if that does happen, if the employer does decide to be primary, even though they're not required to be, we just advise that those beneficiaries get that in writing. In the scenario where somebody is aged into Medicare, 65 years or older, currently working in a company or employer with 20 or more employees, in this scenario, the employer group health plan is primary to Medicare, so Medicare is secondary. So that scenario, that person who aged into Medicare, they can decline Part B if they want to without consequence. If somebody is under the age of 65, disabled, and currently working in a company or employer with more than 100 or more employees, then in that scenario also the employer group health plan is primary to Medicare, and in that scenario again the employee or beneficiary can decline Part B if they want to. And in those two last scenarios, if they do decline Part B, they just want to make sure to use the Part B SEP within 8 months of losing their current employment status. And as I mentioned, the Part B special enrollment period, individuals covered by job-based insurance may be eligible to use the Part B SEP to enroll into Medicare. Just want to make clear that the Part B SEP will start when the individual has coverage from current work, job-based insurance, and they are in their first month of eligibility for Part B. So that means that there has to be a concurrence that occurs when they are eligible for Part B and they also have job-based insurance based on current work. So let's say if I turn 65 in June and I start work, I start another line of work next month in July. Well, the Part B SEP doesn't really pertain to me because if I start work in July, that means that I don't have employer-based coverage on the month that I become eligible for Medicare, which is June. So in that situation, I definitely would want to use my initial enrollment period, my IEP, which is that initial window to enroll into Part B and Part A to enroll into Medicare when I first become eligible. So it has to occur in the same month that somebody becomes eligible for Medicare. That's when the Part B SEP starts, and the Part B SEP will end 8 months after the individual loses coverage from current employment because employment or insurance ends. So they just have to make sure that they use the Part B SEP within 8 months of losing employer-based coverage based on current employment. They could definitely use the Part B SEP while they're still working. So let's say if I become eligible for Medicare right now and I'm still working, I'm still actively working and have employer-based coverage, and this continues for another 3 years. Well, I could use a Part B SEP anytime between now and 3 years from now while I'm still currently working and have employer-based coverage. I just want to make sure that I use that Part B SEP within 8 months of losing current employer coverage. Using the Part B SEP means the individual will not have Part B late enrollment penalty. So we discussed yesterday about the nasty consequences of making erroneous decisions when it comes to either declining or enrolling into Part B. It comes with either huge gaps in coverage, Part B late enrollment penalties that are there for life. So a Part B late enrollment penalty is a lifetime penalty, unfortunately. However, if a person does have access or is eligible for the Part B SEP, then enrolling into Part B through the SEP means that they will not have to deal with any gaps in coverage. They won't have to deal with the Part B late enrollment penalty. But again, it's very, very, very important. Just the key takeaway here is that in order for the Part B SEP to work, employer coverage has to be based on current employment status. So somebody has to be currently working. Somebody would not qualify for Part B SEP if, let's say, they had retiree coverage for the last year and they declined Part B and they should have had Part B for the last year. Or they had COBRA coverage for the last year and they should have had Part B for the last year, they'd be locked out of the Part B SEP because if more than 8 months go by without a person having either Part B or employer coverage based on current employment, then they would no longer qualify for the Part B SEP. So it just has to make clear to the beneficiary that it has to be based on current employment status in order for the Part B SEP to work. And again, just to drive home the message, the individual must meet 2 criteria. They must have insurance from current work, from their job or their spouse's job, or have had such insurance within the past 8 months. And they must have been continuously covered by job-based insurance or Medicare Part B since becoming eligible for Medicare, including the first month they became eligible for Medicare. That's also very important. There has to be a concurrence in that first month of eligibility in order for the Part B SEP to even work. If there is not this concurrence within that first month, then they would be locked out of the Part B SEP. So in that scenario where I became eligible for Medicare in June, but I started employment in July with employer health coverage, then the Part B SEP would not be something that I could use in that scenario. No, the individual is ineligible for the Part B SEP if they are without Part B or job-based insurance for more than 8 consecutive months. And in most cases, individuals should enroll in Medicare before losing job-based insurance to avoid gaps in coverage. So it's always advisable if somebody knows when they're going to retire to use the Part B SEP while they're still working. So if I know I'm going to retire by the end of this month and next month I'm not going to have employer coverage based on current employment, meaning that next month Medicare should be primary for me. I could use my Part B SEP now so that my Part B will become effective July 1st and there would be no gaps in coverage. Yes, I would have 8 months from July, so I'll have until February to use my Part B SEP in this scenario, but that would mean that I would have a gap in coverage. I wouldn't have primary outpatient coverage if I delayed for 8 months, even though I do have that option to do so. It's always advisable for folks to use the Part B SEP proactively if they know down the line, when they're going to retire and when they're no longer going to have employer group coverage based on active employment, on current employment. Are there any questions about this specific part of the presentation, the coordination of benefits between current employment, group health plan coverage?
Yeah, there was a question. Someone asked, what if someone is on workers' compensation?
So if somebody's on workers' compensation, yeah, that's a good question. They would have to be listed as a current employee. If it's a long-term disability, I know in terms of the policy that usually within the first 6 months of long-term disability or workers' compensation, they're usually considered current employee. But after that 6-month grace period, they would be considered an active employee. And there's a differentiation between current employment, which you actually physically working, and an active employment where you're listed as an active employee, but you're not actually physically working. Maybe you're on long-term disability or workers' compensation, and that's usually a 6-month grace period. So you would have to kind of clarify that with the benefits administrator or the HR rep at your company to ensure, what status are you at one point in time? Are you a current employee or active employee? Because what Social Security is going to look for is the time period that you are a current employee and when that current employee status dropped.
Great. That was the only question that came in.
Okay, great. So now we're going to talk about retiree insurance. So retiree insurance, by definition, is insurance that is not based on current employment because it's retiree insurance. It's after somebody retires. So again, health insurance employers provide to former employees who have retired. In almost every scenario, retiree insurance is always going to be secondary to Medicare. There is one exception, and that is retiree insurance for federal employees, which is through FEHB, Federal Employee Health Benefits. But we'll talk about that slight exception. But outside of that, really, all retiree insurance will always be secondary to Medicare because it is not based on current employment. So in terms of retiree insurance and Medicare coordination, many retiree plans do require their members to sign up for Parts A and Part B in order to have the full coverage of the retiree benefits. Although Medicare is primary, it may be beneficial to keep retiree coverage as secondary. So you would definitely, members would definitely want to follow the rules as to how they could keep their retiree insurance intact. And usually that means enrolling into both Parts A and Part B. It can act as supplement to insurance and fill in the gaps after Medicare pays primary. It also may cover services that Medicare doesn't cover, such as routine vision and routine dental. So there's many positives into keeping retiree insurance, ensuring that the retiree insurance is in place by enrolling into Part B when somebody does have retiree insurance. Not only is it really required by law because Part B of Medicare would be primary for a person who has retiree insurance. So if you decline Part B in that scenario, you wouldn't have primary outpatient coverage. But it's also usually a requirement in order to keep retiree insurance. They sometimes require members to enroll into both Part A and Part B. So declining Part B would just not really be advisable for somebody who has retiree insurance and is also eligible for Medicare. However, it's always advisable also to check with a person's HR department or benefits administrator to find out how retiree coverage will specifically work with Medicare. So Medicare individuals with retiree insurance should take Part B, as I mentioned. A retiree plan is paying primary. It may be because it's not aware of individuals' Medicare eligibility. This does occur quite often. We've come across these scenarios on our Medicare Rights Center National Helpline quite a few times where if the person isn't aware about what their requirements are in terms of coordination of benefits and when they should enroll into Part B or when they should decline Part B, oftentimes that is also the case with the employer group health coverage or the employer retiree coverage. Oftentimes they don't know when they're supposed to be paying primary or secondary. And so a person who has retiree insurance who should have taken Part B and decides not to take Part B because maybe a misunderstanding of the rules and the complexities and the confusion that's around Medicare enrollment and Medicare coordination of benefits, that often does occur. Sometimes it may take the retiree health plan to figure out that, hey, we shouldn't have been paying primary for this person for all these months or all these years. When they find out, they'll stop paying primary, so that person will be left without any primary health coverage, at least for Part B outpatient services and doctor services. And they'll probably be locked out of their Part B SEP because if it's been years since that's been happening and it's been more than 8 months that they lost or that they retired, they would have no way to access the Part B SEP. So they'd be locked out of the SEP. They would probably have to wait to the general enrollment period, which we discussed yesterday as well, which is the annual period that starts every year between January and March. And enrolling during the GEP would mean that the Part B would take effect on July, um, causing huge gaps in coverage, and most likely will come along with a Part B late enrollment penalty. So not only will they have to deal with that, but at the same time, they will likely have to deal with recoupment issues that the retiree plan is now recouping claims that they paid as primary when really it should have been Part B that should have been paying primary all this time. So if that can be avoided, very much advise the clients to make the proper decisions with the proper information that they need at the time to make those decisions. So definitely a situation to avoid. If ever you come across a client who's saying, I've retired and I'm become eligible for Medicare, usually the answer to that question would be you should take Medicare Part B. Unless, again, the exception to that rule is if they have retiree insurance through the federal employee program, which is FEHB. So there are obviously different types of retiree insurance. TRICARE for Life is retiree insurance for military retirees and dependents. TRICARE for Life is always secondary to Medicare, so a person should take Part A and Part B if they have TRICARE for Life. In fact, TRICARE for Life requires them to take Part A and Part B in order to maintain or to have TRICARE for Life coverage. Department of Veterans Affairs benefits, so VA benefits, there is no coordination at all between VA benefits and Medicare. A person with VA benefits can definitely use VA benefits at VA facilities, but they cannot use it outside of VA facilities. So if a person with VA benefits declines Part B because they say to themselves, well, I'm getting all my care through VA facilities and it's been great, they've been providing everything that I need, that's great. But maybe in the future or in certain scenarios or in certain situations, they may need to see providers and facilities outside of the VA facility. And if they decline Part B, well, they won't have primary outpatient coverage or doctor's services coverage. So it's usually never advisable for somebody on VA benefits to decline Part B because, again, there's no coordination of benefits between VA and Medicare. So they should take Part A and Part B in order to have primary coverage outside of the VA facilities. And as I mentioned, there is an exception to the rule, and that is the federal employee health benefits. So this is retiree benefits for federal employees. They come in different types of plans, HMOs and fee-for-service. So Medicare is actually primary for those who have FEHB and who decide to take Part B. So if they decide to take Part B, Medicare is primary. However, if they decline Part B, and this is the exception, FEHB is primary to Medicare if they decline Part B. They could have Part A, decline Part B, but FEHB would be primary if they do decide to decline Part B. However, if they do make the decision to decline Part B, that doesn't really nullify any of the consequences or the lockouts that they may experience if they choose to sometime in the future enroll into Part B. So if they decline Part B and because they have FHB and their FHB will be primary, and they go years in that scenario, in that situation where their FHB is primary and they have Part A only, well, if they miss their initial enrollment period to enroll into Part B, then they would have to wait until the general enrollment period if they want Part B in the future, which means that the Part B would take effect on July 1st, and also means that they may be hit with a Part B late enrollment penalty. So just because they can decline Part B, and just because FHB can act as primary for folks who decline Part B, doesn't mean that they're going to avoid any other consequences if they decide to get Part B in the future. So here's another good visual representation of the coordination of benefits that we just discussed. So in this scheme, we're going to ask which is primary. So the type of insurance in the first row is employer retiree insurance. The condition being met is that the person is eligible for Medicare, which is primary. Medicare is, again, usually 99% primary to employer retiree insurance, except for if a person declined Part B and has FEHB retiree insurance. Other than that, Medicare is primary to retiree insurance. However, federal employee health benefits being the type of insurance and the condition being met enrolled into Part B. If they enrolled into Part B, remember, if they decide to get Part B, then Medicare is primary to FEHB. If this same person, let's say this same person declines Part B, then the reverse would be true. FEHB would be primary to Medicare. TRICARE for life. The condition being met is that person becomes eligible for Medicare, then Medicare will always be primary to TRICARE for life. Person who has VA benefits as insurance and the condition being met is that they have a claim from the VA facility, well, then the VA benefits is primary because there's no coordination of benefits between VA and Medicare. So any claims that the person gets through the VA network will be handled by the VA benefits. But outside of the VA network, if they need care or medical attention outside of VA, then Medicare will be primary. And that's why it's usually advisable for folks who have VA benefits to have both Part A and Part B, just to make sure that in those certain scenarios, in those certain situations, when they do need care outside of VA, that they do have primary health coverage. Any questions about any of those specific coordination of benefits combinations?
Actually, a question just came in.
Sure.
Can someone actively working decline both parts A and B and benefit from SEP later on once they terminate their employment?
Sure. So there is no such thing as a Part A SEP, and that's because, and yes, a person can decline both Part A and Part B if they meet those specific criteria where they're still active, currently working, or their spouse is still currently working, and they have employer-based coverage based on that current employment. They can decline both. It's usually that folks will take Part A because it's free for them. There's no premium associated with Part A, at least for 99% of Medicare beneficiaries. Part A is premium free, so they usually end up taking Part A, and they'll decline Part B, and then they can use the Part B SEP to get Part B without any consequence. However, they can decline both A and B. If they are eligible for free Part A, they can enroll into Part A at any time. Enrolling into free Part A can happen at any time of the year. In fact, free Part A can be retroactive up to 6 months. So let's say I turned 65 4 years ago, but I was still currently employed 4 years ago, and I'm still currently employed, and I'm going to retire, let's say in June or July. I declined Part A and Part B 4 years ago when I first became Medicare eligible. Well, I could enroll into Part A now, and it could be retroactive for up to 6 months from now. Because it's premium free Part A, and it could be retroactive for up to 6 months. And then I could use the Part B SEP to get Part B. So enrolling into free Part A is not really any issue, and again, it can be retroactive. And that's why there's not really a Part A SEP. That's why we usually, when we're talking about SEPs, it's really focused on Part B, because Part B does not have that benefit.
And what about the late enrollment penalty for Part A?
So there's no late enrollment penalty for premium free Part A. Again, if you're eligible for premium free Part A and you decline premium free Part A when you first qualify to enroll, there's no late enrollment penalty for premium free Part A. However, if when you become eligible for Medicare, you're not eligible for premium free Part A, because you don't have the required work history, and you decline Part A at that time and Part B at that time, and you enroll into Part A and to Part B at a later point in time, then yes, you will probably be hit not only with a Part B late enrollment penalty, but with also a Part A late enrollment penalty. So that's only for folks, again, who aren't eligible for premium-free Part A, which, again, it's a very small segment of the Medicare population. Statistics show that 99% of Medicare beneficiaries, by the time they turn 65, they do qualify for free Part A. However, 1% of about 60 million Medicare beneficiaries is still a sizable number. For those folks who aren't eligible for premium free Part A, they definitely can be subject to a Part A and a Part B late enrollment penalty if they don't enroll when they first should have. However, there is that QIMBY benefit of the Medicare Savings Program that can pay the Part A and the Part B premiums, and can also eliminate the Part A late enrollment penalty and the Part B late enrollment penalty. And we'll talk about QIMBY and the MSPs in this training today.
Thank you, Gio. That was the only question.
Awesome. And we'll wrap up the Medicare coordination of benefits with Medicare and COBRA. So COBRA, which is the Consolidated Omnibus Budget Reconciliation Act, is a federal law that lets certain employees, their spouses, and their dependents keep group health plan coverage for 18 or to 36 months after the individual leaves a job or loses coverage for certain other reasons, as long as the individual pays the full cost of the premium, which is pretty expensive when it comes to COBRA. However, it only applies to employers with 20 or more employees. In terms of Medicare and COBRA, because COBRA by definition is insurance after employment or after current employment ends, it is not health insurance that is based on current work, and therefore, because of that definition, COBRA will always be secondary to Medicare. COBRA doesn't qualify someone for Part B SEP, so if somebody knows that they're going to be in COBRA next month, they should just make sure to use the Part B SEP within 8 months of losing their current employment based health insurance. So if they, let's say they have COBRA for the next 36 months and they didn't use the SEP at all during that 36 months, then they wouldn't be able to use the SEP. Because again, COBRA doesn't qualify as current employment employer health coverage, and therefore if they go more than 8 months since they lost their job or that current employment status, then they would be locked out of the SEP. So someone with COBRA who is eligible for Medicare should definitely enroll into Part B within 8 months of losing their GHP from current work. If the individual doesn't enroll in Part B within 8 months, they'll most likely have to pay a premium penalty for late enrollment and may have gaps in coverage. Again, they'll be locked out until the general enrollment period comes by, which is every year between January and March. Then they'll have to wait until July in order for the Part B to take effect. And then on top of that, they'll probably be subject to a late enrollment penalty. So COBRA always secondary to Medicare. If that ever comes up in a conversation with your client, just always be aware to counsel them that they should take Part B if they have COBRA. For individuals with COBRA first who become Medicare eligible, COBRA coverage actually usually ends on the date that the beneficiary gets Medicare. That's if they start with COBRA and then they become Medicare eligible. However, for beneficiaries with Medicare entitlement, either a Part A or Part B or both, and they become eligible for COBRA, they must be allowed to enroll into COBRA. However, Medicare is the primary payer. So in that scenario, again, Medicare is always primary to COBRA, but they could keep COBRA coverage as secondary if they have Medicare first and they get COBRA later. But if they have COBRA first and they get Medicare later, then COBRA coverage usually ends on the date that they get Medicare. Any questions about COBRA and Medicare?
No questions so far.
Cool. So now we could jump right into the Medicare cost assistance programs, which is my favorite topic. So here we're going to be talking about 4 programs that can help with Medicare-related cost sharing: Extra Help, EPIC, the Medicare Savings Program, and Medicaid. So Extra Help is the federal program that helps pay deductibles, premiums, copays, and co-insurances associated with Medicare Part D. It only works with Part D plans. However, if somebody doesn't have Part D and they get Extra Help usually will enroll them into a random Part D plan, but they also the person will also have the option to choose their own Part D plan before they get randomly assigned a Part D plan by Extra Help. The Extra Help income limits in 2021 is $1,630 a month if single, $2,198 if married. The asset limit is $14,790 in assets if single, $29,520 in assets if married. So Extra helps with Part D costs. Depending on the level of Extra Help, it could pay the entire premium of a person's Part D plan, or it could help make a partial portion of the Part D premium. It could also help reduce or eliminate the Part D deductibles. It could lower the co-payments on Part D covered drugs. And again, it's really depending on the level of assistance. A person can qualify for either full Extra Help at the lower end if their income is at the lower end of the spectrum, or partial Extra Help if their income is at the higher end of the Extra Help limits. Either if they get full Extra Help or partial Extra Help, they will get increased flexibility to join and change Part D plans. Either Extra Help will allow enrollment in Part D once per calendar quarter in the first 3 quarters of each year. So this is the Extra Help Special Enrollment Period, or the SEP, where they could use once per calendar quarter in the first 3 quarters. So they could use it once between January through March. They could use it again between April through June, and a third time between July through September. Any changes that are made are effective the first of the following month. In the 4th quarter of the year, they don't have an Extra Help SEP, so they can use a full open enrollment period, which starts between October 15th and ends on December 7th, to make that change in the last quarter of the year. But that change will take effect on January 1st of the next year. Also, any level of Extra Help, either full or partial Extra Help, waives late enrollment penalties for Part D. So with full Extra Help, and again, this is the lower end, if their income is at the lower end of the spectrum, full Extra Help can pay the full monthly Part D premium up to the New York State benchmark, which is the New York State average Part D premium. And that is $42.27 in 2021. That means if a person with full Extra Help has a Part D plan that is $30, well, full Extra Help is going to pay that entire $30 premium. However, they have a Part D plan that is, let's say, $50. Well, full Extra Help is going to pay only up to $42.27, and then the beneficiary is responsible for the remaining cost, for the remaining amount of the premium. Full Extra Help also nullifies any deductible. If they have a Part D plan with a deductible, that deductible is waived and they no longer have to meet a deductible. There's no coverage gap with Full Extra Help. They're going to see a steady co-payment throughout their Full Extra Help lifespans, and that's $370 for generics and $920 for brand names. For those individuals with Medicaid and incomes below $1,093 per month, their co-pays under Full Extra Help are actually less. It's $130 for generics and $4 for brand name drugs. Those who are institutionalized and who receive home and community-based services do not have prescription drug co-pays. So their Full Extra Help copay will be $0. So it'll help them entirely with their prescription drug copays. And if they have Full Extra Help and they reach $6,550 in out-of-pocket drug costs, then those individuals will also have no copay to pay towards their drugs after they reach that amount in that given year. Partial Extra Help can reduce the monthly premium. It's based on a sliding scale depending on their income. It could help pay 25% of the premium, 50% of the premium, or 75% of the premium depending on their income. It also lowers the deductible to $92. So if a person has a Part D plan with a deductible of, let's say, $400, Well, when they get partial extra help, that deductible is now reduced to $92, or the plan's deductible, whichever is lower. With partial extra help, there's also no coverage gap. A person will pay 15% co-insurance throughout the lifespan of their partial extra help benefit, or their plan's copay, whichever is less. After reaching $6,550 in out-of-pocket drug costs, the beneficiary will pay $370 per generics and $920 per brand names, or 5% of the drug cost, whichever is greater. So some folks will get full extra help automatically. So if a person has Medicaid, if a person has any level of the Medicare Savings Program or is receiving SSI, they automatically get full extra help. So they get that full, robust extra help. And this is through a process called deeming, meaning they're deemed into full extra help by virtue of these other programs. However, if they don't have any of these programs and they don't get full extra help automatically, they can apply for extra help directly through the Social Security Administration. They have an online portal where you could submit an online application to the Social Security Administration. Folks can also apply by phone or obviously not at this time, apply in person at the local Social Security office pre-COVID pandemic. So generally, folks can use the online portal to apply or contact Social Security to apply over the phone. Beneficiaries can declare their income and assets. They do not have to provide any kind of documentation proof. They can also appeal an application that is denied. Any questions about extra help?
No questions. So
Awesome. Moving right along into EPIC. So EPIC is New York State's SPAP, which is the State Pharmaceutical Assistance Program. A lot of states across the country have an SPAP, and New York has one, and their version of the SPAP is EPIC. However, EPIC is only for folks who are 65 years older, so only for Medicare beneficiaries who are eligible for Medicare due to age. Enrollees will receive an SEP for Part D once a year, so they have an EPIC SEP to use once in that calendar year. They can use it at any time in that calendar year to change the Part D plan or to enroll into a Part D plan if they don't have a Part D plan. If they get approved for EPIC and they don't have a Part D plan, they can use that EPIC SEP to enroll into a Part D plan for the first time. Lowers the Part D copays depending on their income. If their income is at the lower end of the spectrum, EPIC can help pay their Part D premiums. EPIC is separate from Extra Help. EPIC is a state pharmaceutical assistance program. Extra Help is a federal assistance program. The beneficiary may qualify for EPIC even if they do not qualify for Extra Help, and the beneficiary can have both EPIC and Extra Help concurrently. So EPIC eligibility is pretty generous. There is no asset test. EPIC income limits are based on previous year's income. So in 2021, the income limit for a single person is $75,000 a year. So if a person made less than $75,000 a year in 2020 in the previous year, then they would be eligible for EPIC this year. If a married couple made less than $100,000 in the previous year in 2020, then they would be eligible for EPIC this year. Of course, always keep in mind that EPIC is only for individuals who have aged into Medicare. So if they're 65 years or older and their income is below these thresholds, they should be eligible for EPIC. It would not be eligible. It would not be a program, unfortunately, for individuals who are under the age of 65 at this time. So beneficiaries can apply for EPIC by phone. That's the EPIC helpline, or by mail. They could send the EPIC application to that PO box, and we provided links to the EPIC applications there, and also links to EPIC applications in different languages. Any questions about EPIC before we talk about MSPs?
no questions so far. I know this is supposed to end at 11.
Yes.
Yeah. But everyone be able to stay on for a couple more minutes? I shouldn't take that long, right? Gio?
Should I? Yeah, we're in the home stretch. And yeah, I lost track of time. Apologies for that.
No, no.
So yeah, we're pretty much in the home stretch. So Medicare Savings Program. So I'm sure folks have already heard me talk about Medicare Savings Program ad nauseum. So the MSP, one of the more robust benefits available here in the state of New York. So at a minimum, the MSPs can pay the monthly Part B premium, which in 2021 it's $148.50. But also the MSPs can eliminate a late enrollment penalty. So all those nasty consequences that we talked about in yesterday's training and even today's earlier portion of the training, if somebody does enroll or declines Part B when they really shouldn't have, and maybe they get Part B at a later point during the general enrollment period, and they're subject to a Part B late enrollment penalty, well, if they get the MSP, that penalty is waived from their record forever. Even if they lose the MSP down the line because maybe they failed to renew it, that penalty doesn't come back. So it's a great benefit to eliminate a Part B late enrollment penalty. Also, if somebody is in a situation where they don't have Part B because of a decision they made, an erroneous decision they made that was based on, not the most accurate information, or maybe it was because of the complexities and confusion of the Medicare enrollment and the Medicare coordination of benefits rules. Maybe they declined Part B when they shouldn't have, and now they don't have Part B and they have to wait until general enrollment period, which starts in January, to get Part B. Well, if that person comes to you, usually the best tool or the best route to help them get into Part B as soon as possible is a Medicare Savings Program. So you'd want to screen them for the Medicare Savings Program. If they're eligible and they get approved for the MSP will actually enroll them into Part B outside of the general enrollment period. So as soon as they get the MSP, they will get Part B, and their Part B effective date will match their MSP effective date. So the MSP is just a really robust and great benefit for particularly for folks who find themselves in those very disastrous situations where they decline Part B when they shouldn't have, and now they're either dealing with Part B late enrollment penalty or being locked out of Part B until the general enrollment period and until July of next year. Also, every level of the MSP will, as I mentioned before, will provide automatic enrollment into full extra help, and this is a process known as deeming. They're going to be deemed into full extra help. And depending on the type of MSP that they get, it could also pay the Part A premiums and provide billing protections for Part A and Part B co-insurances and deductibles. So this is only available through the Quimby level of the MSP, and we'll talk about Quimby at a later slide. So these are the types of the MSPs: QI, SLIMB, Quimby. QDWI is a very rare level of the MSP. It's really only meant for folks who are under the age of 65, return to work, and because they started working and started earning above the substantial gainful activity level, they lost their eligibility for premium-free Part A. QDWI can pay the Part A premiums only. It's very rare to my knowledge. There's not even one active QDWI MSP in the state of New York, but it is another level of the MSP. Here are the 2021 income limits for the three common levels of the MSP. For QI, if single, the monthly income cap is 1,469. If married, is 1,980. For SLIMB, is 1,208 if single, and 1,762 if married. And for Quimby, the lowest income level, it's 1,094 monthly income cap if single, and 1,472 if married. These figures already include an automatic $20 disregard for every application. We just do the math for you, and we include that disregard into this figure. So these are the maximum limits that you will see. Other health insurance premiums can be subtracted from income. So if a person has, let's say, other health insurance like a Medigap, maybe a standalone dental plan, a standalone vision plan, they can use the amount of that premium to actually lower their countable income. So for example, let's say I'm making $1,500 a month. I'm getting $1,500 a month from Social Security, that would put me over the MSP income limit. But let's say I'm paying $200 a month for a Medigap that I have. Well, $200 will be deducted from my $1,500, and my countable income will now be $1,300 because of that Medigap premium. And at $1,300, I would be eligible for the Medicare Savings Program. So the MSP does allow the use of other health insurance premiums as a form of income deduction to lower a person's countable income. Also, as you can see here, we're only showing income limits and net assets, and that's because there is no asset test in the state of New York for the MSP. That was eliminated in 2008. All the MSP looks for is a person's monthly income. And as I mentioned before, Quimby is often regarded as the most generous level of the MSP because Quimby is the only level that not only pays the Part B premiums, but it can also pay the Part A premiums. I mentioned yesterday's training that while the majority of the Medicare population is eligible for premium-free Part A by the time they age into Medicare, by the time they turn 65, there still is that pretty sizable segment of the population, 1% of 60 million is quite a bit of folks who, by the time they age into Medicare, they don't have that 10-year work history to qualify them for free Part A. Therefore, they'd have to pay both the Part A and the Part B premium. And as we mentioned yesterday, the Part A premiums get pretty expensive. It could go up to, I forget the exact amount, but it's about $400 plus for the Part A premium if a person has less than 7.5 years of work history. Well, if they're eligible for Quimby, Quimby can pay that Part A premium and the Part B premium at the same time. So it's a great benefit for folks who would qualify for a Quimby who find themselves in that situation where they don't have the work history for a premium-free Part A. Medicare providers will offer another benefit of the Quimby program is that if a person has Part B only, but doesn't have Part A, the Quimby program can actually enroll that person into Part A of Medicare and then pay the Part A and the Part B premiums. Quimby will also offer what's called balanced billing protection, meaning that a Quimby beneficiary cannot be made responsible for Medicare cost sharing. So this is true even if the provider does not accept Medicaid, even if they are in a Medicare Advantage plan, and this is for all Medicare services. So Quimby beneficiary really doesn't have to be responsible for the 20% coinsurance after Part B pays, or any other Medicare cost sharing, really. And MSPs are administered by the local departments of social services. Every county has an LDSS. In New York City, the LDSS is HRA. Medicare Rights is always available to submit MSP applications on behalf of clients who live in New York City. We do have a standard relationship with HRA where we can submit directly to them. And we could track outcomes of the MSP application for New York City residents. And of course, there's also the ability for folks to submit applications directly to HRA themselves. So Medicaid is a state and federal program offering health insurance to those with limited incomes and assets. Each state has its own Medicaid rules. All Medicaid programs are regulated at state and federal level. People of different ages and groups may have different financial qualifications and limits. So in terms of the Medicare beneficiaries, they usually fall under the ABD or age-blind disabled category. Prior to becoming Medicare eligible, folks would usually be categorized under the MAGI budgeting methodology or the modified adjusted gross income, which may qualify them for expansion Medicaid on the New York State of Health. But once somebody becomes Medicare eligible, they would have to be determined eligible for age-blind disabled Medicaid or traditional Medicaid, which is the more restrictive Medicaid with strict income limits and an asset test as well. And here are the income limits for Medicaid in New York State in 2021. If single, the monthly income will have to be below 904 in order to qualify for full Medicaid. If married, it's 1320, and there is also an asset test as well. And in terms of Medicare and Medicaid, a person could definitely have both. They're known as dual eligibles. Medicare is always primary to Medicaid. Medicaid is a payer of last resort, so it will never pay primary to Medicare, unless it's something perhaps that maybe Medicare doesn't cover. Then in those cases, Medicaid may be able to cover services that Medicare just doesn't cover, such as dental, vision, hearing services, transportation to medical appointments. But when Medicare can cover things, Medicare pays first, and then Medicaid can pick up the remaining costs. Individuals with Medicaid, as I mentioned before, should automatically be enrolled into full extra help. Okay, so that wraps up our training for today. I can stick around if there's any outline questions.
No questions. Gio, is it okay if I share your information in the follow-up email?
Oh, sure, of course.
Great. Thank you so much, Gio. I know we have one more training with you this afternoon.
Yes, this is not the last time. Unfortunately, you guys have to hear my voice.
Yes. So yes, thank you everyone for joining us this morning, and Gio and I will see you in the afternoon. Thank you.
Bye, everybody. Talk to you later.
Bye.